an exploration of COVID-19 risk and vaccine hesitancy among LGBTQ Pennsylvanians. This research is presented by Bradbury-Sullivan LGBT Community Center and Bryn Mawr College Graduate School of Social Work and Social Research. Researchers at Bradbury-Sullivan LGBT Community Center and Bryn Mawr College initiated an IRB-approved study of vaccine access and vaccine hesitancy among LGBTQ Pennsylvanians. Community members were asked about their knowledge, behaviors, and attitudes towards the COVID-19 vaccines, as well as their adherence to precautions, including wearing a face mask and practicing social distancing. The community survey found that most LGBTQ Pennsylvanians are following guidelines regarding face masks and distancing in public spaces. The data also suggests that most LGBTQ Pennsylvanians want to be vaccinated against COVID-19. More than half had received at least one dose of a vaccine at the time of the survey. However, barriers to care are limiting LGBTQ Pennsylvanians' ability to receive vaccination for COVID-19. Our survey found that of those who have yet to be vaccinated, 40.8% did not know where to receive a vaccine, and 46% had not contacted anyone about making a vaccine appointment. Other barriers include misunderstandings on the costs associated with the vaccine, transportation to vaccination sites, and the needs to take time off work to receive the vaccine and/or recuperate from side effects, as well as the possibility of adverse side effects. LGBTQ Pennsylvanians who were undecided or unwilling to get a COVID-19 vaccine were more likely to be concerned with safety and efficacy than those who were not hesitant about vaccination. Among LGBTQ Pennsylvanians not hesitant about getting a COVID-19 vaccine, the most frequently reported concern was feeling that others needed the vaccine more than them. Concern for others was the most reported reason that might prevent this group from vaccination. Findings from the survey include disparities in vaccination rates, as well as factors related to rural and non-rural location. Respondents who reported being HIV positive were more likely to have received one or more doses of a vaccine compared to other groups. Additionally, HIV positive LGBTQ Pennsylvanians also reported strong willingness to receive the vaccine if they had not already. Black LGBTQ Pennsylvanians are accessing COVID-19 vaccinations at a lower rate than the larger LGBTQ community, expressing less certainty about where to receive a vaccine and displaying more hesitancy than other LGBTQ Pennsylvanians. Living in a rural county may be a factor in whether or not LGBTQ Pennsylvanians have received a vaccine or are vaccine hesitant. Rural and non-rural LGBTQ Pennsylvanians may have different needs regarding vaccination access and education. Rural LGBTQ Pennsylvanians were more likely to be vaccinated than those living outside a rural area. However, unvaccinated rural respondents may be more hesitant than those living in suburban and urban areas. From this work, we also have suggestions on how to design a community survey for the LGBTQ community, including making equity a priority in every step, being aware of implicit bias in question design, carefully considering your demographic questions, and considering your target population and who your survey will actually reach. Do you have the partnerships necessary to reach your target population? The online community survey was able to reach a diverse LGBTQ respondent pool across the state, collecting important information on the impact of COVID-19 vaccination. Some lessons learned from this work include the importance of multi-channel survey administration and how funded promotion may increase response rate and improve the diversity of your respondent pool. That designing survey questions that adapt to a rapidly changing vaccine landscape should be considered wherever possible. And that when time allows, pilot testing demographic, sexual orientation, and gender identity questions can provide important feedback on the preferences of your target audience. Recommendations from this work can be found in the full report and include offering vaccinations at LGBTQ+ affirming community-based sites in order to address barriers to care, providing tailored information to LGBTQ+ Pennsylvanians using trusted messenger strategies. Public health professionals and healthcare providers should consider utilizing an intersectional approach to addressing vaccine hesitancy and prioritizing sexual orientation and gender identity data collection in COVID-19 vaccine tracking. Thank you to our data collection partners.